Men's health. Prostate cancer is the most common cancer among men, but it can often be treated. Joining me to talk about early detection and risk factors is Dr. Tung Hsu with UT Health, Houston and Memorial Hermann. Thank you so much for coming on the show.
Good to see you, Zach. Thank you.
This is a really important conversation. It sometimes can be a tricky conversation to have with men. It's a sensitive topic. How do you go about talking about this?
Well, this is one of the things I always want to inform my patients that prostate cancer is the most common cancer in men today in the United States. However, it can be, if you have early detection through screening, you can save a lot of issue in terms of prostate cancer metastasis, also save someone's life. So this is what I want to address.
Signs and symptoms of prostate cancer.
Well, the thing about prostate cancer, when it's early, there's usually no symptom. That's the issue. That's why screening is very important in this case.
Yeah.
Because when someone has symptoms, typically it's already, the cancer may have spread.
Yeah. Who should get screened, and at what age should those screenings begin?
That's a very good question. For example, prostate cancer is typically in men between age 55 to 69. Very rarely, someone who's under age 40 would develop prostate cancer. So people under 40, we don't recommend that. Between age 55 to 65, that's where most common cancer happens, prostate cancer happens. So we recommend patients go through the screening process. And we do know that in Afro-Americans, there's a higher risk of prostate cancer developing early. So for those people who have family history or Afro-American, we recommend start at age 40 and 45.
Do we know causes behind this type of cancer?
There's some genetic correlation with it. For example, there are some studies show that increased dairy intake may increase risk of prostate cancer.
Some correlations between the two, and that's fascinating.
Yes.
And then there are a whole slew of treatments, advanced treatment.
Yes, sir. And that's the thing. There are so many different options. For a long time, our options are either prostate cancer surgery or radiation. Now, if you detect it early, if there's only a small spot of prostate, there is prostate cancer, we can recommend focal therapy. More importantly, when the cancer is found very early, we can recommend active surveillance, where we don't have to treat until when it gets aggressive.
Yeah. And again, I just want to really hit home. It is Prostate Cancer Awareness Month. And again, this can be a very sensitive, uncomfortable topic to have with your partner, with your father. But it's an important conversation to have.
Yes, very important. Now, what I recommend a lot of my patients is that if you are not sure if you want to undergo the prostate cancer screening or undergo detection, have a blood test, have an exam, come to the office. We have a good conversation about it, and we tell you what the pros and cons have an early screening. And if you do get diagnosed with prostate cancer, how the options can help you save your life, and also move on with quick recovery, so you can move on with your life.
Yeah, it's really important to have that conversation and potentially save lives.
Yes.
Okay.
Yes.
Thank you so much for coming on the show this morning.
No problem.
I appreciate your time.